Thanksgiving is 2 weeks tomorrow, and not everyone lives close to loved ones. While the CDC recommends limiting travel if you must, health officials say it's smart to get tested before and after. But which test do you get? Our reporter Allison Basil consulted with local health officials to break down the pros and cons.
To test or not to test, and how.
This is a rapid, Sophia Quidel rapid.
Most healthcare facilities like Velocity Urgent Care offer COVID-19 antigen testing known as a rapid test.
They come back in approximately 15 minutes.
Medical Director Dr. Tiffany Sibley says results are quick, but the CDC backs using a diagnostic test or PCR.
Nothing is going to be 100% of the time, including PCR. But PCR is definitely what we would consider to be a gold standard.
Centera Healthcare's Director of Laboratory Services, Eric Young, says they exclusively use PCR tests. He says the CDC recommends a rapid test only if a person has early symptoms.
If you've gotten symptoms within 5 to 7 days, an antigen test might be accurate. The biggest concern is you have a much higher chance of getting a false negative test with an antigen.
What makes a PCR's accuracy different than a rapid test?
They're using different technologies.
Young says a PCR test scans for a virus's genetic material.
We can detect a really small amount of virus in somebody's sample that we have.
Rapid testing technology scans for virus proteins.
And it needs a lot more of them to be able to find them.
Both officials say a rapid test speed is beneficial, but if you get a negative result, you may need a follow-up test.
A negative rapid result, but we had a high suspicion that the patient was truly positive, well, then we could back that up with a confirmatory PCR test.
And Dr. Sibley says they're getting PCR lab tests back in about 3 to 5 days. Both the PCR and rapid tests use this nasal swab. It looks intimidating, but health officials say only about a third of the swab goes into the nostril. Live in Norfolk, Allison Basil, 13 News Now.